It's a pleasure to be here today. This is quite an event, and I wanted to thank Janine Johns and the Long Island Radio Group for inviting me to speak today. They really, Radio for Cure is an absolutely unbelievable and powerful event. It's brought many of us together today, which are helping Long Island to help the women become very aware of what they need to be doing for early detection. This outreach to the Long Island community by the Radio for Cure helps women be sure to remember, not just in the month of October, but every month, what they need to be doing for early detection. I think October serves as that red flag month to say, hey, are you doing what you need to be doing 12 months a year, not just the month of October? As mentioned in the introduction, we're talking about the components of early detection. We discussed breast self-examinations, clinical breast examinations, and breast imaging, which can incorporate mammograms, sonograms, and breast MRIs. We are very fortunate on Long Island to have wonderful breast imaging in various powerful groups that help women get the right information early. As to when a woman does one of these three components is dictated by age and family history. And although family history is important, we must remember that only 10 to 15% of breast cancers are related to hereditary at this time. But as mentioned also in the introduction, there is so much research going on that I am sure we're going to find additional mutations in genes which are responsible for breast cancers and other cancers. All three components, the clinical breast exam, breast self-exams, and breast imaging, are dictated also, as I mentioned, by age. The earlier breast cancer is detected, obviously, the more options a woman has for her management, the better chance she has for survival, and potentially for cure. When I first limited my practice to breast cancer work back in the early to mid-1980s, I think there were two things that pushed me to do this. One was a patient who said to me at the end of a conference, you really enjoy discussing and making sure that we understand the options available today, because at that time breast conservation was just coming into the realm but was not being offered adequately by surgeons throughout this country to women. They were still discussing mastectomy only. And the patient said to me, why don't you give up the rest of general surgery and limit your practice to breast work exclusively? I have to say it was a real seed for thought as I went home that evening. And that, along with my patients coming in with misinformation, really pushed me, I wouldn't say over the edge, but to the proper edge to do breast work exclusively. And I've never regretted that decision. If anything, it's allowed me in my more mature years to still love what I'm doing. So the three myths that patients were what I call the three myths, which I kept hearing over and over and over again, is my mammogram is normal. This thickening or lump can't possibly be anything. Well, that's wrong. Breast imagers will tell you all the parts of breast imaging cannot reach 100%. You still have to take in the clinical breast examination, and there's often necessary to do a needle biopsy of something you feel, even when the mammogram, particularly in a woman whose breasts are dense, does not demonstrate the abnormality. Another myth that I've heard is, gee, I have no family history. There's no way I'm ever going to get breast cancer. Well, I mentioned earlier, that too is not correct. But also, when you're discussing family history, it's amazing how many women did not appreciate until the last couple of years how important family history is. And not just is there breast and ovarian cancer in your family, there are other syndromes that look for others, like thyroid cancer. So there are multiple cancer syndromes. So history, family history is very, very important, and not just for the breast cancer component. And the last myth, which to me is really quite important, is I'm too young. I can't possibly have breast cancer. Yes, it's uncommon to get breast cancer in the 20s and 30s, but I've been practicing for 30 to 35 years now, and I think every lump, every change in a woman's breast should be pursued until you can actually say this is nothing. We're never too young because age is no longer a protection for many things. So I would just strongly encourage everyone, despite your age, to pursue sonograms or whatever is age appropriate, and then go on to the other breast imaging studies under the auspices of your breast imager or physicians. I would like all of you to help me as we leave here today to remember these 3 myths and see if you can help and reach out to the community along with all the wonderful groups here. The radiologic groups, the coalition groups, the advocacy groups, the foundations, 1 in 9, the Adelphi Hotline, every part of Long Island and these various groups, and the monies put forward to back all of us to help the Long Island community are important, and I thank all of you. Please be proactive. It's very, very important. And just remember, every month is Breast Cancer Awareness Month. Thank you.